Okay, let's talk about the injuries that therapists sustain and how and why. Unfortunately, 90% of the injuries that we see for therapists are all going to be related probably either to the fingers, more so the thumb. Incorporate the wrist, overuse tendon injuries to the elbow, and then further up the chain. Okay, God forbid we start moving into peripheral nerve entrapments. The reason for the injuries in and around the hand, the thumb, and the wrists is probably because of poor habits or education from therapists who have been probably not involved in a lot of clinical experience, because if that's the case, then they're probably sustaining injuries themselves. So if you take on these bad habits early on in your career, then unfortunately then you carry them through. And if you do, it means there's a fair chance you'll burn out very early on, especially when in relation to your hand and your thumbs. So let's just think and use a little bit of common sense here. You're using your hands and thumbs predominantly for most of the regions of the body. You're going to fall into some peril. There's no doubt about it. Quickly, if we look at the biomechanics of the thumb itself. Now, for the most part, a lot of people who have taught how to use their thumbs in this direction, obviously trying to put the load through the actual thumb itself. But unfortunately, that's not sustainable, because obviously 9 times out of 10, the hand starts to move away to get more pressure. And that means greater pressure onto the joint itself. There are those that wrap the hand, okay, to support and then come down through. So now you're putting more load to the first joint of that thumb as well. And that is not sustainable as well. This is a small joint, which is got a little bit of movement. It's got small ligaments that stabilize it, and it doesn't have a huge joint capsule. So the moment you start putting your body weight through this joint means that you're starting to overload all the structures that interplay with that joint. Okay, so we're talking the tendon, we're talking the ligaments, we're talking the condyle surfaces, the joint capsule itself, and obviously the muscle. So the muscle fatigues. As a muscle fatigues, it down-regulates. Some other muscles got to kick in and up-regulate, usually the synergistic, and then you're putting load through onto the ligaments, which are small, intricate ligaments, and then onto the joint surfaces themselves. So straight away, you're not doing that in a sustainable way. Not only that, you're doing it over and over and over again. So if you're then doing 8 massages a day and you're using that process for your thumbs and your fingers, straight away you can start to see where things are going to go wrong. And it doesn't take long. A little bit of pain here, a little bit of pain there, a little bit of sharp pain at the end of the day, and then obviously they may start to ache at night. And then obviously the gap closes between your symptoms and how often you feel those. Weakness builds in, and then God forbid you start obviously trying to adapt. Now, that's where you need to be mindful about which tools you use for which areas. So if you're using your thumbs for areas like your glutes, deep external rotators, quadriceps, hamstrings, erector spinae, big muscle groups, even the calves for that matter, then that is not sustainable. You need to be looking at using your hand, your wrists, obviously your forearms and your elbows. These are going to be the best tools for working these areas. There's no excuse. You've got adjustable electric tables now, so we can adjust our client to whatever height we need, depending on how high we are. And then you can start to use and transfer your body weight. Now that should be taught to you well early on in the picture. Okay, bending one knee, keeping one leg straight, and then leaning into your clients, okay, and using the appropriate tool. The other thing is too, a lot of therapists, even when they're using their elbow, they start to move their shoulder away from the midline. And that's an issue too, because now you're putting a lot of load through the actual shoulder joint itself. So you need to nurture and come in and actually hold that whole area and make sure that pressure is going through sustainably and not out through the shoulder itself. So if you're out here and you've got the tissue here and you're working out there, that's not good for this area here. Trust me, that's shoulder pain waiting to happen. Not only that, neck as well. So when we're using our hands or we're using our fingers, we're going to use them in the appropriate way. So if you're working around hand, neck, face, all these sort of, even the fingers, even the feet and then around the ankles, absolutely. Totally sustainable. But if you're using for the large muscle groups, then you need to drag yourself out of that habit really quickly, because those habits are going to lead to you burning out and having injury, which is almost hypocritical because you're in the business for healing people, but at the process you're injuring yourself, and that's not what it's about. So instead of enjoying and loving what you do, you're starting to resent and you're in pain. So that's not ideal. So take yourself out of those bad habits and start employing smart. That's why we built together and done, I think there's maybe 12 videos dedicated to different regions of the body to use the right sort of body mechanics in those areas. You've got electric tables, so there's no excuse there. You just need to drag yourself out of those habits and start exploring with others. You will build the palpation and the skills as you move through this. Okay, so you are all at peril of ligament injuries, muscle obviously, tendon overuse injuries, peripheral nerve entrapments, God forbid joint issues as well. So if you're not exploring that and you're not taking yourself out of that environment, you're inviting all of those to come in. And that's a grim expectation. So you need to start looking at the way that you work. Now, a large part of that for me in checking in on my biomechanics was actually having a mirror put right in front of me in my clinic, in front of my table. And it is still there today. And I can see myself working every day. It's one of the best tools that you can get in terms of your feedback. So you will drag yourself out of those bad habits. You will start moving in towards using your body correctly. Stay away from using your hands and your fingers for those bigger areas. You're supporting your joints as you work through those areas, even with your wrist, because at the same time, a lot of pressure through there with the wrist in extension is not ideal, but it's far more sustainable if you're in this position here. But like anything, you need to practice it and you need to bring yourself out of those environments where injury is going to creep in.